Hi, I'm Melody Charbonneau. This is part 1 on social anxiety disorder for my advanced abnormal class for LeTourneau University. Social anxiety disorder, or social phobia, is characterized by an excessive fear of social or performance situations. This could includes evaluation, criticism, or rejection. There are two main categories, generalized and specific social anxiety disorder. Generalized social anxiety disorder would include a fear of large crowds, conversations, and other normal social events, whereas specific social anxiety disorder gets down to things like public speaking, eating in public, meeting strangers or authority figures, or other performance situations. These situations cause excessive anxiety, which then causes the person with the disorder to avoid these types of situations. Social anxiety disorder is the third most common mental disorder in the United States. This is behind substance abuse and depression. About 12% of the population will experience this disorder at some point in their lives. It's most commonly found in adolescents, Western countries, and females. Western countries over Eastern countries because Eastern countries are more accepting of these types of behaviors and don't view it so much as a disorder. Some of the consequences of social anxiety disorder is that it is extremely distressing, and people with the disorder often experience a reduced quality of life. They might recognize that their anxiety is unfounded or excessive, but can't seem to do anything about it. Others might feel anxious about having the disorder in general. Some symptoms that people might experience would be blushing, sweating, and catastrophic thinking. There are also relationship problems, poor social networks, reduced support, employment and education difficulties, along with an increased risk of suicide. In addition, there are comorbid disorders, such as depression, sexual dysfunction, and substance abuse. About 70% of the time, social anxiety disorder develops before the comorbid disorders. This leads to the belief that it causes these other disorders. Some people with social anxiety disorder attempt to avoid these anxiety-inducing situations. However, not all of these situations can be avoided. Unavoidable situations must be endured. This is usually with extreme anxiety. Young people often have the disorder. They're usually overlooked or undiagnosed, at least until they're absent from school. This is because the disorder itself causes them to do their best to avoid being noticed. So, a brief history on the disorder. Excessive shyness and social anxiety were mentioned as early as Hippocrates, but it really came into focus in the 1900s. In 1903, it was termed Phobie de situations sociales by Janet, and in the 1930s, social neurosis by Schleider. In the 1950s, Joseph Wolpe's work really increased the interest in this disorder, and by the 1960s, Isaac Marks' work really separated it into its own category. In 1980, the American Psychiatric Association added it to the Diagnostic and Statistical Manual of Mental Disorders, 3rd edition. It was also in the 1980s that the first treatments for children were published. By 1985, it was described as the neglected anxiety disorder because of the lack of research. However, that was really changed in the 1990s as there was an explosion of research. It was also in the 1990s that the name began to change from social phobia to social anxiety disorder. Social anxiety disorder has a diathesis stress model of causation. This is where biological predispositions are triggered by psychological or environmental stress. In general, there are biological, cognitive, social, relational, and experiential risk factors for social anxiety disorder. It's unclear exactly which psychological or life event factors are necessary for the development of the disorder. Some biological causes. There are areas in the brain that are linked to this disorder. This includes the amygdala and the thalamus. The amygdala is involved in face perception. This is the perception of other people's expressions on their face. This is a complicated process that involves several brain structures. But amygdala hyperactivity has been noted particularly. This tends to cause a negative bias in face perceptions. Abnormalities in the thalamus are linked to generalized social anxiety disorder, the pulvinar in particular. The pulvinar is the largest thalamus nuclei. It is determined to be indispensable in generalized social anxiety disorder neurocircuitry. Hyperactivity of the pulvinar in particular distorts emotional and sensory processing. This has been linked already to several other disorders, such as obsessive-compulsive disorder, specific phobias, and depression. Relational and twin studies have found a genetic link to these anxiety disorders. However, this is a little bit unclear, as most relatives and twins are unaffected, which then indicates that there are other factors involved. A couple of social or environmental causes would include dysfunctional family environments, such as parents who are critical and controlling, or the parents might have the disorder themselves and model the behavior for their children. It's also possible that the parents restrict the children's access to social situations, which then inhibits their ability to develop social skills. A couple of social contributors are bullying, victimization, and rejection. A few other non-biological causes are behavioral inhibitions and bias processing. Behavioral inhibition would be a predisposition to avoid new people and situations, much like shyness. However, it's unclear whether this is a precursor to social anxiety disorder or just anxiety in general. Biased processing would include facial perceptions and emotional and sensory processing that are biased. Some maintenance factors for social anxiety disorder. Most models agree on the importance of several key factors: the anticipatory and post-event processing, avoidance and safety behaviors, social skill deficits, negative self-processing, cognitive biases, operant conditioning, and cognitive avoidance. Anticipatory and post-event processing enhances the detection of threat and reinforces that threat. Studies have shown that this results in higher social anxiety. Avoidance and safety behaviors prevent exposure to evidence against the threat and maintain the threat. They also reduce opportunities to develop social skills, whereas social skill deficits have found mixed results. Studies can't quite decide whether or not these are contributing. And cognitive avoidance has been recently proposed. A couple of diagnostic criteria. First, the DSM-5 definition. 1. It's a persistent fear of one or more social or performance situations in which the person is exposed to unfamiliar people or to possible scrutiny by others. The individual fears that he or she will act in a way that will be embarrassing or humiliating. 2. Exposure to the feared situation almost always provokes anxiety. This might take the form of a panic attack. 3. The person recognizes that the fear is unreasonable or excessive. 4. The feared situations are avoided or else endured with intense anxiety and distress. 5. The avoidance, anxious anticipation, or distress in the feared social or performance situation interferes significantly with the person's normal routine, occupational or academic functioning, or social activities or relationships, or there is a marked distress about having the phobia. 6. The fear, anxiety, or avoidance is persistent, typically lasting for 6 or more months. And 7. The fear or avoidance is not due to the direct physiological effects of substance, such as drugs or medication, or a general medical condition, and not better accounted for by another mental disorder. There are also several self-report measures. The Leibowitz Social Anxiety Scale assesses fear and avoidance, both interpersonal and performance situations. The Fear Questionnaire, reported to have good reliability, has 3 subscales. It assesses avoidance behaviors associated with feared social situations, agoraphobia, and blood and injury phobia. The Fear Survey Schedule has 4 subscales: social fears, agoraphobic fears, animal and insect fears, or blood and injury fears. The Social Avoidance and Distress Scale and the fear of negative evaluation scale were designed to complement one another. However, they do not discriminate social anxiety disorder from other anxiety disorders. The social avoidance and distress scale assesses the distress and social avoidance behaviors, while the fear of negative evaluation scale assesses fear of negative social evaluation by others. The social interaction anxiety scale and the social phobia scale were also designed to be used together. These assess social interaction and performance fears. The social phobia and anxiety inventory assesses somatic symptoms, negative thoughts, overt behaviors in distressing situations. This was Part 1 on social anxiety disorder by Melody Charbonneau. Part 2 will have a case study along with treatment options. Thank you for watching. Bye.